Hello and thank you for joining us for Northwest Newsweek. I'm Riley McManus. The Thunder Bay District Medical Officer of Health thinks Thursday's loosening of restrictions in Ontario could lead to more local cases of COVID-19. While many health units have seen a significant drop in COVID numbers lately, Dr. Janet DeMille doesn't see that happening here due to the province's ending of capacity limits. Corey Nordstrom has more.
The district's medical officer of health has been encouraged by the downward trend in case numbers locally, but with capacity limits and gathering sizes now increased, she believes that trend could reverse.
And of course, there's more reopening happening today, and that could actually reduce the speed at which we're declining. There could be sort of an increase in cases or COVID activity as a result of that.
The neighboring Northwestern Health Unit has seen its active case count more than double in the past week, leading to some strong recommendations by Dr. Kit Young-hoon. She is advising gatherings stay at 10 people indoors and 25 outdoors, rather than the 50 and 100-person numbers now allowed, as well as recommending that businesses stay at 50% capacity. Dr. DeMille wants people to stay vigilant, but she's not making similar recommendations or restrictions.
I certainly don't want to put on any additional restrictions, and I actually don't think they're warranted.
DeMille says she was fine with Ontario expanding gathering sizes and capacity limits 4 days ahead of schedule, but she wasn't thrilled about the Ford government ending proof of vaccination on March 1st instead of the original date of March 14th.
That longer time period between those steps would have allowed us to would have accommodated any increase of COVID activity that we might have seen, and it would have allowed us to continue sort of the drop that we're already experiencing prior to a further reopening.
Those aged 12 to 17 can now receive their third dose of the vaccine with no appointment needed at the Coliseum building. The health unit had been running 2 clinics on the CLE grounds in recent weeks, but the one at the Heritage building was shut down last week due to low demand and a new focus on targeted vaccinations. Corey Nordstrom, TVT News.
While hospitals across Ontario seem to be moving in the right directions in terms of COVID-19 patient numbers, the same cannot be said here locally. Thunder Bay Regional Hospital President Rhonda Crocker-Ellicott says their hospitalizations have remained high for several weeks now.
Today we're at 47, but our average census has moved from 27.9 in the month of January up to 46.2 on average during the month of February. So although we do see weekly cases coming down provincially and hospitalizations coming down provincially, unfortunately in the north, we're not quite there yet. We're seeing our trends continue.
Of the 38 COVID patients currently in hospital, 10 of them are in the intensive care unit. Hospital occupancy remains above 100%, and the ICU sits at 68%. The capacity issues continue to cause delays for people waiting on non-urgent and non-emergent surgeries. Crocker-Ellicott says they've been able to begin carrying out some of those procedures, and they plan to increase surgeries as soon as they begin to see COVID hospitalizations numbers drop.
It's a balancing act, so we're working very closely with our clinicians to assess patient care need every single day with the available capacity and resource availability. So we're doing what we can in order to increase volumes because we know that there are significant patient needs and there's been significant delays and concerns with respect to postponement of these cases.
And as the province moves into the next phase of reopening, the head of the Northwestern Health Unit has some concerns about the resulting impact in that part of the region. The area's case count remains stubbornly high at 442 cases as of Friday, and the NWHU's positivity rate is still the highest in the province at 22.7%. While the majority of other health units have seen significant declines, Medical Officer of Health Dr. Kit Young-hoon says while she's happy businesses can begin returning to normal, the health unit will have to keep a close eye on local COVID-19 statistics.
Could potentially worsen our numbers. So I think that's something we'll be looking at closely over the next 2 weeks, is to see what the impact this reopening is going to have on our epidemiology and our statistics and of course our hospitalization rate.
Young Hoon cautious residents that even though restrictions are lifting soon, it's important to remain cautious and make the effort to follow ongoing public health measures. Cases of COVID-19 continue to grow in the Northern First Nation communities. Anishinaabe Nation Grand Chief Derek Fox is calling out the provincial and federal government for a lack of consultation on loosening restrictions when things are far from okay up north. Several First Nations are in the state of an emergency as nursing shortages and overcrowded homes sit atop the concerns of leadership. Alex Flood has the details.
A number of communities across Anishinaabe Nation are still seeing high COVID-19 numbers relative to Ontario's latest totals. On Thursday, NAN was reporting 651 active cases in just 25 of their communities. 5 of those First Nations are under a state of emergency and have suspended non-essential and inter-community travel. Grand Chief Derek Fox says the provincial government is lifting restrictions too quickly and fears for the health and safety of residents living in Nan.
We know for sure that they did not take into consideration that the far north is still fighting this pandemic, and that we are still very deeply concerned with the possible risk of loss of life, and of course the risk of people getting very sick.
Mushkegowgaming Ojibwe Nation has witnessed a slight decrease in cases as neighboring communities and support teams have flown in to provide assistance. Meanwhile, Edmonton First Nation tops the list of active COVID cases in Nan First Nations with 158. Their nursing station is experiencing staffing shortages, and concerns surrounding a burned-out healthcare system continue to mount. He also says many area homes are overcrowded, making the virus more transmissible.
Once a case is found within the First Nation, people need to isolate. There's nowhere for them to go. If there's 10, 15 people in a home, how are they supposed to isolate? You know, there's no buildings for them to go to. I know in Bearskin, when that outbreak happened, there was talk of some domes being sent up. But it's minus 40, minus 50 up there at this time. So how are those domes going to help?
NAN is also seeking clarification from Transport Canada on how the current vaccine travel mandate will be affected as restrictions are eased. Fox is hopeful an update will be provided within the coming days. Alex Flood, TBT News.
North EMS are asking Thunder Bay residents to only call 911 for urgent medical situations. The local ambulance bases are facing significant staffing shortages after a number of paramedics either contracted COVID-19 or were forced to isolate. EMS Chief Wayne Gates says response times for non-urgent calls will be longer than normal.
Right now, we're looking at about a loss of about 20% of our workforce. So, as you know, we paramedics service both City, Thunder Bay, and the district, and so we're looking at about 25 to 30 people are off right now due to COVID.
Up until now, the local EMS has been relatively unaffected by the virus. Gates says the vast majority of the employees off the job are due to COVID exposures that are not work-related. He commends his remaining staff for working overtime and coming in on days off to serve the community, and expects his staffing levels to return to near normal in the next week or so. But in the meantime, he wants the public to be aware of the possible delays and to know when not to call for an ambulance.
And we are still getting to those people fairly quickly, but there are some of the less urgent calls that might be considered minor in nature that often really don't require an ambulance. And we will be delayed getting to those responses. And what we're doing is we want to encourage the public that for some of those calls, maybe they should look at other resources such as walk-in clinics or contacting their primary care or Ontario Health.
When we come back, statistics released by the OPP show a rise in tractor-trailer unit-related collisions on area highways. The Northwest Region OPP has released its collision statistics for 2021, and they show a significant increase in crashes involving transport trucks. There were also more than twice as many highway fatalities in the region last year compared to 2020. Jonathan Wilson reports.
Any number of fatalities on the highway is concerning.
Staff Sergeant Cheryl Davidson is the OPP's traffic manager for the Northwest region, and she says the return to more normal traffic levels in 2021, following the stay-at-home orders in 2020, is one reason for the increase in collision-related deaths. The statistics show the Northwest region saw highway fatalities in the single digits from 2018 to 2020, but that number jumped to 13 in 2021, more than double the previous year.
We want to see no fatalities on our highways. Unfortunately, we've never seen that. And it's a sad state, and there's multiple reasons for that. Of course, back to what I said about the global pandemic, in 2020, we had a lot less motorists on the highway just based on the pandemic and a lack of travel. So yes, we did have an increase in 2021.
The OPP stats also show the number of area crashes involving transport trucks was up to 488 last year, after going up and down the previous few years. However, the percentage of motor vehicle accidents involving big rigs has been steadily increasing and was over 21% in this region last year. Many people have been blaming unsafe or inexperienced transport drivers for the increase in fatalities and overall collisions. But Davidson says that generalization may not represent the whole truth.
I guess it depends how you look at it. Sometimes we have, as I said, had passenger vehicles causing those collisions with transports. It depends on the circumstances, and it is difficult. We have to look independently at each of these collisions to see what the factors are that are involved.
Davidson says she has not seen the statistics yet regarding the number of highway closures there have been this winter compared to other years. But she says it's safe to say this has been a worse winter for snowstorms, which have then resulted in collisions and numerous highway shutdowns. But once again, she challenges the notion that transport drivers are solely to blame.
Sometimes not only commercial motor vehicle drivers, but also passenger vehicle drivers make decisions to drive on our roadways when it's not necessarily safe due to weather. So I think all of those factors contribute to the collisions that are happening. And certainly we have, as I said, had a very challenging winter with regards to weather.
The one positive statistic is that the total crashes on northwestern Ontario highways are down 20% compared to pre-COVID levels. Jonathan Wilson, TBT News.
The OPP has confirmed that some of its officers from here in the Northwest have been deployed to Ottawa on a voluntary basis to help end the occupation in the nation's capital. The service hasn't disclosed how many people have gone, saying only that it's a contingent of frontline officers, emergency response members, command staff, and civilian workers. Kenora Mayor Dan Reynard calls himself very fortunate to have been selected to sit on a recently announced Northern Transportation Task Force. The task force was announced in late January and will take on an advisory role to assist the province in transportation planning with a lens directed to the north. Of the 13 members, almost half of them represent organizations or communities here in the Northwest. Joining Reynard are Northern Policy Institute President Charles Sirtwell, Ground Council Treaty No. 3 Ogichita Francis Kavanagh, Anishinaabeg Nation Regional Deputy Chief Melvin Hardy, Sioux Lookout Mayor Doug Lawrence, and Shunya Mayor and NOMA President Wendy Landry, who also serves as co-chair of the task force. Reynard says that group alone brings a lot of diversity and perspective to the overall task force on the topic of highways. Reynard says now that the twinning from the border towards Kenora has begun.
In Ontario with the three-lane highway, which I've seen, and it's quite interesting. You know, is that an option for I think anytime you get a number of people in the room, you get a chance to share ideas. And so I'm looking not only to bring forth my ideas, but to hear what other people are seeing, what they're experiencing, and what they think.
Reports of a suspicious vehicle in Dryden Monday morning have led to the arrest of 2 men, one from Kenora and the other from Thunder Bay. Officers followed the vehicle before it entered a carport of a home where the suspects could not identify why they were on the property. The men were arrested following a brief altercation, and the search of the vehicle allowed officers to recover stolen property, including a firearm and various drug-related items. Both have been charged with break and enter and resisting a peace officer, along with several possession and firearms-related charges. The number of active fire halls in Greenstone has decreased by 1, following the closure earlier this year of the Karamat Fire Hall. It comes amid discussions of provincially mandated training requirements for many small communities that use the volunteer firefighting model. And as Adam Riley explains, those changes could be financially unbearable for those communities.
Residents of Karamat will have to rely on nearby Long Lac for fire protection from now on, following a decision to close Greenstone's easternmost ward's fire hall due to a low roster, which had been whittled down to 1 active member. Deputy Mayor Jamie McPherson says with the closure and a longer distance now for first responders, the municipality will be taking a proactive approach to minimize the number of calls for service.
We're going to be expediting education for the residents and the members of that community on fire prevention so that we do our best to minimize the risk that they may feel.
The equipment at the Karamat Hall will be redistributed to where it will be best put to use in the municipality, which has 4 other fire halls. However, things are about to get complicated for those remaining 4 halls. The province is proposing mandatory training and certification requirements for firefighters, which became a major topic of discussion at Council Monday evening. It was there Greenstone CAO Mark Wright laid out the hard facts.
The training will be expensive. Even if we can grandfather, so to speak, half of our department, we're talking 78 to 80 firefighters that there is regularly, I'll call it churn, but regularly people turning over, new people coming in, people leaving. And so we'll be seeing a constant need to train.
The current roster of firefighters for all of Greenstone is 7 in Beardmore with a vacancy of 12, a full complement of 25 in Geraldton, 10 current and 9 positions open in Nakina, and Long Lac rounds out with 15 active members with 4 spots free on the roster. McPherson says each station should have a minimum of 15 members, the same amount of firefighters for a municipality the size of Belleville.
Yet we don't have that population. So the expectation that's being placed on us is that we have to train these people to the standards that they're looking towards. We don't know how to do that. Financially, it's over 6 figures.
McPherson says most municipalities in the Northwest will be in a similar situation as Greenstone, and he's hoping those communities and the Northwestern Ontario Municipal Association will be able to provide lobbying support with the province.
We're not looking for full-time, and they're there as volunteers. They don't want it to be a full-time job. So therefore, what can we do to make this work?
The province is now taking comments from municipalities for guidance on this proposal until the end of the month. Adam Riley, TBT News.
Coming up after the break, the Geraldton District Hospital shifts its focus on recruitment of medical professionals.
We were faced with a possible closure with our emergency department.
Maintaining the numbers of medical professionals, especially physicians, has been a hard task for communities across the region for many years as a result of the global pandemic. Resources have been strained even further, with some medical facilities experiencing burnout of physicians. To address that, recruiters at the Geraldton District Hospital in Greenstone have shifted and expanded their efforts, which have so far paid off. Adam Riley has the details.
Greenstone has a lot going for it right now as the result of the construction of the new Greenstone mine, which continues to bring workers and new residents to the municipality. With an increased population comes the increased demand on the healthcare system. And while Geraldton's new $21 million expanded emergency department, which opened last year, has been beneficial from a staffing perspective, doctors were running on fumes, which on more than one occasion reached a critical point.
We were faced with a possible closure with our emergency department in July 2021 and December 21.
Greenstone Deputy Mayor Jamie McPherson says normally locums from other areas of the province would come in and relieve pressure, allowing full-time physicians some time off. But COVID-19 has changed the game through new health and safety and isolation protocols.
Well, some of them cannot come up because of the protocols. The amount of time they'd have to isolate, the 14 days before and after. And so that meant the load fell on the existing physicians.
To counter that and prevent burnout, Geraldton District Hospital's physician recruitment team shifted their focus to bring in a nurse practitioner, which, unlike regular registered nurses, can diagnose, order tests, and prescribe treatments. Rocheleau says immediately a positive effect was felt in the emergency department, with 93% of patients being taken care of by the nurse practitioner. The success of that introduction was noticed by others and allowed GDH to have an impact beyond the Greenstone area.
Atikokan was actually struggling with the exact same thing we were struggling last summer. They were looking at potentially closing the emergency department. They reached out to us, and we actually sent our NP down to Atikokan, and she was able to work in the emergency department, which kept them open.
Currently, GDH is looking to add a second nurse practitioner to their ranks while continuing to entice physicians to move to Greenstone. Rocheleau says plans are in the works to create an urgent care clinic in the emergency department to further reduce strain on the system. Adam Riley, TBT News.
6 local organizations are receiving some important funding to help them better serve the community. Almost $3 million from the DSAB Social Service Relief Fund will cover a number of projects for local shelters, kitchens, and more. Vasilios Bellos has the details.
The nearly $3 million in funding is for the Thunder Bay District Social Services Administration Board. It helps 7 initiatives from 6 organizations, with 2 projects from Ottawa First Nations Management receiving the bulk of the funding, over $1.5 million. Dilico Anishinaabeg Family Care also receiving a significant amount, $800,000. Also on the list is $231,000 for Grace Place, $195,000 for Urban Abbey, $77,000 for Marjorie House, and $52,000 for John Howard Society. District Social Services Administration Board CEO Bill Bradica says without this funding, many of the projects would not be possible.
It's been used to assist some existing organizations with their buildings to improve, for example, kitchen facilities, air handling systems, and in some cases to expand existing space. So for example, at Urban Abbey, to expand from 4 shelter beds to up to 10 shelter beds for women.
Part of the funds allotted to Ottawa First Nations Management will be used to create supportive housing units for families, which is still under construction, as well as a new community kitchen. Program Manager Robin Halliak notes the impact the new build will have on residents and the community alike, teaching important life lessons and providing a sense of stability.
It can really mean the difference between keeping their kids and not keeping their children. We know that if we can reduce those barriers for families that are struggling, the less likelihood that we'll be seeing kids apprehended and taken into care. So for our families, it isn't women specific, it isn't men specific, it is about families and keeping them together.
The first community kitchen is planned for March, while construction on the community housing is set to be completed in the spring. Vasilios Bellos, TBT News.
And that wraps up tonight's Northwest Newsweek. Thank you so much for joining us, and we hope to see you again.